In the 1960s, Salvador Minuchin laid the foundation of the structural family therapy approach. This approach focuses on the transactional patterns within families and what effect these patterns have on a family's health and wholeness. Symptoms, according to the structural family therapist, are viewed in the context of the family's internal organization or structure. The foundation of this family structure is a set of rules the family has developed in order to function. If the rules of a family aren't flexible, they run the risk of failing to adapt to the ever-changing stresses of life. The therapeutic goal is to offer the family relief of their symptoms by promoting active structural change within the family system as a whole. The goal of the family structural therapy contribute individual symptoms to the overall dysfunction of the family structure and believe that the primary therapeutic goal has been achieved when the family learns to restructure itself by creating boundaries between members that are clear and more flexible. According to Minuchin, subsystems which are based on characteristics such as gender, generation, interest and function are building blocks of a family system. Clear and flexible boundaries help maintain the functions of the systems by defining who participates and who does not. Boundaries which are too confused and too rigid lead to confused relationships and roles between family members. This causes an imbalance in the overall family system, which according to theorists should be led by a healthy parental subsystem. The counselor attempts to persuade the theories of family by joining the family system and assuming a leadership position. After the therapist successfully joins the family, he or she attempts to define their organizational structure in an effort to create a family map that will guide the family towards the active change that is needed. Counselors use various therapeutic techniques to help them reach their goal, for example, boundary making, in order to realign relationships between subsystems, as well as unbalancing to change the relationship within subsystems. The therapist's role is to intervene with the family actively during sessions by assuming a leadership position. By doing this, the therapist is able to map the family's underlying structure to boundaries, hierarchy, and subsystems. Then, a therapist intervenes to transform the structure with direct requests to the family to change how the members interact with each other. The strengths of the theory. The theory provides structural framework to understand the unique structure of a family and help to illuminate dysfunctional patterns of a family. Structural theory provides therapists tools that can be used to help the family restructure itself. Weaknesses of the theory. The opinion about the structural family theory is that the theory is too aggressive and confrontational, causing the therapist to seem as if he or she lacks empathy for the clients. This is problematic because empathy in the counseling relationship is easily considered as the most important aspect of therapy. Case study. The structural theory approach is applicable to the Demo family because of the fact that the parents, Tanya and Sean, struggle to agree on boundaries, which result in having no boundaries when it comes to their 8-year-old son, Jake, who is having problems socializing with his own peer group in school. Because of the fact that Tanya and Sean cannot agree on boundaries makes it clear that there is no one in control. The first step in structural family therapy would then be to join Sean and Tanya in a position of leadership. Once this is done, therapy continues with enactment. This gives space for the parents to talk to each other. This will be where each of the parents gives their side of the story, as well as their thoughts towards their son's behavior and what they expect from one another. The next step is structural mapping. This includes all members of the family. Once a family begins to interact, transactions emerge and the therapists recognize their structural implication by focusing on process and not content. Boundary making is the next step. This is where a therapist seeks to realign the relationships between subsystems. Minuchin says families are organisms in a continuous process of changing while trying to remain the same. Therefore, structural therapists emphasize complementarity by asking members to encourage each other in their process of change, because of the fact that people have a fear of change, which is part of unbalancing. This is the process to change the relationship within a subsystem. Last but not least, challenging unproductive assumptions. This will be the process of changing the way a family views the situation in order to enable them to change the way they interact. By following these steps of structural family therapy, each family member would be assisted. Sean and Tanya's relationship would be better because they interact with each other, knowing how each of them feel and what is expected of them. They also have leadership position. This means that by the help of their therapist, they would agree on setting boundaries and creating a solution to Jake's behavior. By giving and knowing the role of each family member will illuminate the imbalance in the family and the relationships among the children and parents. Giving each family member a role will also give Jake a greater clarification of where he belongs, which will be beneficial to his situation. If Jake knows who he is and where he fits in, he will see the resemblance with the children in his peer group and will feel more acceptable with them. The therapeutic goal has thus been achieved because the family learned to structure itself by creating boundaries between members that are clear and more flexible. Through this, Jake knows his boundaries and his belonging, as well as that of his parents. If Jake can soon, through the help of therapy, socialize with his peer group, and Sean and Tanya can agree on boundaries, the stress levels and tension in the house will lower, which is also beneficial for the whole family. The structural theory approach has become the most widely used conceptual model in the field. The reason for this is because the structural theory is simple, inclusive, and practical. The most important tenet of this approach is that each family has a structure, and this structure is only revealed when the family is active. Subsystems are units of a family based on functions and are regulated by interpersonal boundaries. By applying the structural therapy approach to the demo family, we can see that the structural therapy gives the therapist a framework for understanding the unique structure of a family and can help to illuminate dysfunctional patterns that are developed over time.